Good morning, and thank you for joining today's press conference. Today, all speakers are joining the briefing virtually to hear the social distancing guidelines. The topic for today's briefing is the city's response to a lawsuit by the tobacco industry. We will begin our briefing with opening remarks from Health Commissioner Dr. Thomas Farley. Dr. Farley, you have the floor.
Good morning. Thanks very much for joining. Tobacco companies have sued the city of Philadelphia over a law that was passed last year to protect our teens and young adults from some highly addictive and dangerous products. I'm here today with others who care about our young people to explain what is happening so that this action doesn't go unnoticed. First, background. Tobacco is the leading killer in Philadelphia. The best estimate is that it is responsible for the deaths of more than 3,500 people in Philadelphia each year through diseases like heart disease and stroke and cancer. Put that in perspective, that's twice the number of deaths we've had from COVID-19 so far. And those deaths from tobacco occur every year, not just in a single year. Now, all tobacco products are highly addictive and dangerous, but there's some products that are specifically designed to entice children and teens and young adults into getting addicted to nicotine in the first place. Products that we're particularly concerned about today are flavored cigarillos. There's several key features of these products that make them particularly dangerous to young people. First of all, they're cheap. Now, the tobacco companies take the leaves and put them into a cigar instead of a cigarette in order to avoid cigarette taxes. And then they put them 2 or 4 or 5 to a pack instead of 20 to a pack. And they sell those packs for $1 instead of about $11 at retail for a pack of cigarettes, so that they can be purchased by young people who have very little cash. Then, and most important, they imbue these cigars with sweet flavors that are attractive to children. Those are flavors like fruit punch. I'll show you one right here, fruit punch, grape, mango, watermelon, using the same flavoring chemicals that are used in candy and that are used in Kool-Aid. And they put them in packages with wrappers so they look like candy. They have pictures on them of sweet snacks, such as a watermelon here, a vanilla ice cream cone here, and a brownie here. And they sell them right next to candy in bodegas. So the children growing up seeing them every day make to them these products seem normal and appropriate. And they're ready to buy them whenever they get old enough to buy them for themselves or whenever they can get them from their older friends. Now, these products are marketed in a way specifically to target minority youth. You see these products in bodegas in North Philadelphia. You don't see them in Chestnut Hill. Now, in December 2019, the Philadelphia City Council passed an ordinance sponsored by Council Member Curtis Jones to protect our kids and young adults from these products. The law restricts the sale of these cigar products that have flavors. I should point out that flavors in cigarettes are already banned at the federal level. The ordinance says that the only stores that can sell these flavored cigars are what we call adults-only stores. Those are stores where no children are allowed to enter. That way, children wouldn't be enticed by these candy-flavored cigarillos every time they go to a bodega to buy a carton of milk. Now, under the ordinance, the tobacco industry could still sell cigars. They could sell cigars without flavorings at any store that has a tobacco sales permit, or cigars with these flavorings at these adults-only stores. Now, to me, this is the least we should do to prevent our children, teens, and young adults from becoming addicted to these killer products. Considering that they're killer products, this is like selling COVID-19 at corner stores. Many would argue we should have done much more. But the tobacco companies won't accept even this minor step to protect the next generation. They have sued the city to block the ordinance. So who exactly is suing us? Well, first, there's a company called Swedish Match North America. Now, if you go on their website, they say, quote, "Our vision is a world without cigarettes," which sounds great until you realize that they don't make cigarettes, that they make cigars. And particularly, they make cigarillos in flavors of mango and pineapple and brownie, the one I showed you a minute ago. They sold 1.7 billion of these cigarillos in 2019. And they say on their website, quote, "Swedish Match will drive profitable growth with strong sales and marketing execution." Then there's another company called Swisher International. Now, Swisher International sells what's called Swisher Sweet Cigarillos in flavors like grape, and tropical fusion. If you go on their website, they say their corporate purpose is to, quote, celebrate human connection, foster creative expression, and strengthen community. The third company selling this is what's called ITG Cigars. According to Dun & Bradstreet, this is a subsidiary of Imperial Brands PLC. This is the fourth largest tobacco company in the world, headquartered in the United Kingdom. They have revenue in the billions of dollars per year. That's more than the entire budget of the city of Philadelphia. If you go on their website, they say, quote, we take pride in what we do and how we do it. Acting responsibly and with integrity has helped us create and sustain a successful business. These companies ought to be ashamed of themselves for marketing these products in the city of Philadelphia and for suing the city of Philadelphia for trying to protect our young people from these products. They should listen to their own corporate statements. And now at the Philadelphia Department of Public Health and the city of Philadelphia, we are working hard for racial equity, including health equity. If you want to see one concrete example why African Americans have higher rates of cancer and heart disease, you don't have to look any further than these flavored cigarillos. So we're here today because we want everyone in Philadelphia to know exactly what the tobacco industry is doing and what impact that will have. If these products still stay on our shelves in Philadelphia's bodegas, more Black and Latino teens and young adults will start smoking, get addicted, and die of cancer and heart disease. If these companies were as responsible as they claim to be, they wouldn't market these products here and they wouldn't be suing us. Now I'm going to turn it over to the next speaker.
Thank you, Dr. Farley. I'd like to introduce now Councilmember Curtis Jones.
Good morning, everyone. I want to thank you for joining us virtually today. I want to particularly thank Dr. Farley, who has become a local health legend dealing with the pandemic in the city of Philadelphia, as well as dealing with gun violence, which are major causes of inner city deaths in Philadelphia. Many people have asked why we proposed this legislation. Some people found out that I lost both of my parents, my mother and my father, to tobacco-related illnesses, one lung cancer and another aneurysm. I found my mother in her living room with a lit cigarette in the ashtray when we took her out by emergency ambulance. But that's not the reason why I proposed the legislation. During my course as duty as a grandfather, I was tasked with taking my granddaughter to her school from Winfield to Center City. And one of the tasks was to get her a healthy lunch. In that process, we stopped at local stores, one after another. And we weren't able to find a healthy lunch. But what I did discover was right next to my granddaughter's favorite snacks, Skittles and others, there was flavored tobacco. And her untrained eye couldn't tell the difference. And she would point and say, I want that one, or I want that one. And it dawned on me that the health department's research dealing with Dr. Farley and his competent crew, that there was something to the marketing of this. And we began to research it and statistically take a look at what was going on. And in inner city neighborhoods, this was the way these flavored tobacco cigarettes were being marketed. And most disturbingly, to our children through advertising called hood snacks and others like that. So we're very concerned about it and introduced that legislation. So now, going forward, we found out that we were being sued, that we worked with the industry to find compromises, like, why don't you move the cigarettes away from candy? Dr. Farley didn't agree with that, but we were willing. Nothing happened over a year. So we moved the legislation, and my colleagues, I'm thankful, passed it, and we now have a law. Now, the irony is that City Council has been sued by two mega industries. One of them is the tobacco industry. The other is the NRA. I don't think that's lost on coincidence that the two major causes of death in our inner city, tobacco and firearms, are joined in philosophy in suing the city of Philadelphia, who is just trying to protect itself from preventable causes of death. And with that, we look forward to the fight because as an inner city West Philly kid, I realized that sometimes when you go on to the schoolyard and have to deal with the bully, it doesn't matter whether you win or lose, you do have to stand up to it. Thank you.
Thank you very much, Council Member. I'd like to introduce now Aiden Gibbs.
Hello, and good morning, everyone. My name is Aiden Gibbs. I'm 18 years old, and I'm part of the Advocacy Institute's Real Talk Tobacco program. Thank you for allowing me to speak on this pressing issue that greatly affects youth and young adults. I spent my senior year waiting around for a friend while they supported through nicotine addiction. She just had to bum $1 to walk away with 2 to 4 swishers. She always knew what flavor they were and how popular by what was put closest to the clear glass. Dollar swishers next to dollar candy. We knew Black and Mild, Dutch Masters, and Backwoods by name and colorful design from the posters on the sides of stores that surrounded our predominantly Black neighborhood. She thought she'd tried them all. I watched her compare Backwoods Honeyberry to Black and Mild Mixed Berry, talk about the way she hated both, and go back to peach. Philadelphia passed this law to protect people like my friend from getting addicted through flavors. I had never seen her pick up an unflavored cigarillo until they were gone, and it was too late for her because she got addicted. Last year, my peers with the Advocacy Institute's Real Talk Tobacco program testified at City Hall to lend our voice in support of restricting flavored cigarillos sales so that young people and young adults in Philadelphia would have a fighting chance against big tobacco. And big tobacco picks now, during a civil rights movement, to sue Philadelphia to be allowed to put products back in Black neighborhoods where it all started for my friend. To put them back in Black neighborhoods during COVID, with a disregard for the greater risks the disease poses on Black people, and those like my friend who are now in high risk due to a history of smoking nicotine. The Advocacy Institute is not done fighting. Youth and young adults across Philadelphia are demanding that the people in power uphold these protections against these predators. We are not your target. Yeah.
Thank you very much, Aiden. I'd like to introduce now Dr. Frank Leone. Dr. Leone.
Thanks so much, Jim. And thanks very much to the speakers that have come before me for laying out the problem so beautifully. I'm listening and learning something new with every perspective. I actually just have a couple of quick points I wanted to add to the story so far. I am a physician. I'm a pulmonologist at the University of Pennsylvania. I spend my time taking care of patients that suffer the ravages of tobacco dependence and the effect on the heart, lungs, brain, the vascular system. Our practice sees 1,500 Philadelphians each year that show up with difficulties related to tobacco dependence, the easy access to tobacco, and the attractiveness of these flavored products, these inexpensive cigarillos that are virtually every 30 or 40 feet in Philadelphia. We did a quick study and mapped out sources of tobacco that influence our patients' health trajectory. And the average distance from our patients' homes to the nearest tobacco retailer is about 100 yards. And so it's really not that difficult to find flavored tobacco inexpensively in small quantities. These cigarillos are the perfect example of easy access to tobacco that keeps the addiction going. When I first heard that Philadelphia was pursuing this legislation, I thought this was a great idea. It was sort of a no-brainer. This was the kind of policy that would protect public health at the same time as limit access to these dangerous products, to, for children. And that, to me, seemed to be at least the overt goal that the tobacco industry had been talking about for a really long time. They keep saying they don't want kids to get access to these products. This is an adult decision. And I thought that the legislation as it exists achieved exactly that. It seemed to me that Philadelphia was on track to be, almost like a partner with the tobacco industry to kind of achieve both goals. And then when I heard that the industry decided to sue Philadelphia, I thought, wow, I'm living in an alternate reality or something. It seemed really silly to me that in the middle of a pandemic, the likes of which we haven't seen in 100 years, in the middle of a cry for social justice, that the industry could be so interested in preserving profits over people would drive them to this very sort of silly conclusion. I thought it's kind of the trifecta of silliness, to keep a product in the neighborhood that increases the risk of getting COVID-19 infection, that increases the risk of developing severe COVID-19 disease, that increases the risk that a person with COVID-19 will end up in the ICU on a ventilator. Suing to maintain access to a product that has been shown unequivocally to be attractive to young children, really young children, like the councilman said. The untrained eye of the child is the perfect target to be attracted to these products. And then, of course, these are products that are really not necessarily designed to be lifelong products for most people. These are introductory products. They're cheap. They're easy to get. They're flavorful. It's almost marketed as a party in a foil pack. And then once dependence actually takes over and begins to influence the brain in really subtle but profound ways, then the ability to sort of decide whether or not to continue using these products is curtailed in that population for the rest of their life. So I'm 100% behind the city's ordinance. I think that it was a really smart and fair and well thought out law. And I'm just really surprised at how silly, how sort of, for an industry that makes an awful lot of money, the depth to which greed can actually drive legal decisions is really just dramatic to me. So I'll leave it at that. And I do appreciate the opportunity to speak my mind, and I'll stand ready for questions when the time comes. Thank you.
Thank you very much, Doctor. We'll now move on to our Q&A portion. For members of the media, reporters are asked to limit their questions to 3 or fewer. We'll do a second round of questions if time permits. Please try to keep those questions focused on the topic at hand. If there are other topics, questions that members of the press would like to ask, please reach out to me afterwards, and we can set up interviews or statements at that point. For those logged in today, feature, it can be found under the participants list. We also ask that you use video to ask your question if you're able. We'll unmute any reporters who have a question one by one. All right, first up I have Pat Loeb from KYW. Pat, you have the floor.
When and where was the suit filed? Was it in the Eastern District or a different court?
Pat, I'm going to direct you to Danielle Walsh. She's a member of the City Law Department who can answer that question.
And thank you for that question. The lawsuit was originally filed in the Philadelphia Court of Common Pleas. The city actually filed removal papers to the Eastern District based on the claims that the plaintiffs were raising.
Has it been moved?
Yes, it has been moved, and the case is currently scheduled for an injunction hearing before the Eastern District on October 7th of this year.
That's all.